Hi, my name is Kandel-Sapkota, and today's date is September 25th, 2025. I am making video to define these topics, and reference for my video is my Professor Dr. Rodriguez's lecture videos, slides, and reading materials. So the first one is the disease definition. So disease is the condition of body or mind that causes distress, discomfort, and dysfunction, and is often associated with the signs and symptoms. So example of diseases are hypertension, diabetes. And then next topic is the disease classification. So disease could be classified based on multiple factors. So one of them is based on etiology or cause of the disease. So it could be classified as infectious disease, nutritional disease, environmental disease, genetic disease, right? So example is Down syndrome is the genetic disorder, whereas lead poisoning is the environmental disease. Or the disease could be classified as acute or chronic based on its origin and duration. Onset and duration. So acute has a rapid onset and it lasts for a short duration of time. Example is common cold, appendicitis, whereas chronic has gradual onset and it lasts for long term. Or like lifelong. Examples are diabetes, hypertension. Or disease could be classified based on the body systems, right? Depending on what body system it affects. It could be cardiovascular, gastrointestinal, neurological, and so forth. So one of the example is hypertension is the cardiovascular disease because that's the system it affects. Or disease could be classified based on the transmission. If a disease can transmit from one person to another without the proper precaution, that is a communicable disease. Example is tuberculosis, measles, COVID, or if the disease doesn't transmit from one person to another, it's a non-communicable disease. Examples are diabetes and hypertension, cancers, and so forth. So that's the classification of disease. So next topic is etiology. So etiology is basically study of cause of the disease. Example is tuberculosis is caused by the Mycobacterium tuberculosis. So that is the etiology of it. Next topic is pathogenesis. It's basically how a disease develops and affects the body. It's just the progression of the disease. Example is in food poisoning. You ingest a contaminated food that contains the salmonella bacteria, and when you ingest it, it gets introduced to your body in your GI tract, and in the intestines, those salmonella bacteria, they release the toxins, and reacting to those toxins, your body reacts with like a nausea, vomiting, abdominal cramp, diarrhea, so it's basically like progression in how the body reacts throughout the course of the disease. So that's the pathogenesis. And our next topic is symptoms. So symptoms is what patient feels or tells. Example is in common cold, patient could have symptoms of pain, fatigue, fever, runny nose, whereas signs are something I could detect or measure. So example is taking a temperature of the patient, and if it's 101 degree Fahrenheit, yes, that's a sign, that's fever. And another topic is the syndrome. So syndrome is basically, it's a combination of the clinical characteristics. Example is Down syndrome. So in Down syndrome, there are a combination of clinical characteristics which include distinct facial features, heart defect, and then neurological dysfunctions, like disability. So this is basically the combination of the different clinical characteristics. That's the syndrome. And next topic is the diagnosis. Basically, it's the identification of a disease or condition. So based on sign and symptom diagnostic test, you are able to identify what the disease or condition is. You basically name it. For example, based on the sign and symptom, you might say, okay, it's a common cold because of these things, and you give the condition a name, like, okay, this is common cold. So that's the diagnosis. And next one is complications. So complication is basically like additional problems that could happen if the disease or condition is not managed timely or properly. Example is if the diabetes is not managed on time or properly, then it could lead to kidney failure, vision loss, nerve damage. So those are the complications of diagnosis. And another topic is prognosis. So prognosis is basically what it tells is your chances of survival, recovery, and improvement from certain disease or condition, right? Example is common cold has an excellent prognosis because your chances of survival are high and you will recover fairly quickly without much complications. Whereas cancer has a poor prognosis because your chances of survival are low, and then your recovery is not as easy, so it has a poor prognosis. And another topic is the diagnostic test. So it's basically a medical test to detect or monitor the progress of the disease or condition. So example is in diabetes, you could monitor patients. You could do the blood test to monitor patients' blood glucose or A1C. So it's that's the diagnostic test. It could either detect diabetes or it could monitor the progress of the diabetes or management of it. So that is what the diagnostic test is. Let me see. I think I covered all of them. Yeah, pretty much I covered all of them. Thank you so much.